Thank you for this opportunity to present. My name's Alex. I'm a fourth-year resident in Danbury, Connecticut. We have no financial interests or relationships to disclose. Colon cancer is the third most commonly diagnosed cancer in the United States. Up to a quarter of patients present with metastasis at the time of diagnosis. And traditionally, these patients have been managed with a staged approach with a colectomy first, followed by chemotherapy and hepatectomy. However, with improvement in hepatic surgery, now more and more patients are undergoing synchronous resections. And the aim of our project was to determine if there was increased risk of perioperative adverse outcomes, specifically surgical site infections with this approach. So this was a retrospective analysis of the National Surgery Quality Improvement Program. We used the hepatectomy targeted files from 2014 through 2019. And the outcome of interest specifically was the surgical site infections broken down into superficial, deep organ space, and wound dehiscence, although we looked at other perioperative adverse outcomes. We performed univariate logistic regression analysis followed by multivariate logistic regression analysis controlling for the confounding variables. This is a schematic of our patient selection. So after exclusion criteria, we had 7,445 patients in the study, the majority of which were metachronous resections or just hepatectomies, almost 94%. And then 5.8% or 431 patients had the synchronous colorectal with hepatectomy. This table is relatively busy, just displays the characteristics, baseline characteristics of all our patients. For the most part, they were similar, although there's some variation in the race. And this table demonstrates the univariate analysis of all the adverse outcomes we included. There was no significant differences in most of them for both approaches. However, we did see an increased risk of sepsis, return to the OR, and prolonged hospitalization for the synchronous approach. And then for the infections, most of the infections on univariate analysis didn't have a significant difference except for organ space infection. So then we proceeded with the multivariate analysis controlling for the confounding variables. And in this table, you can see that the superficial and deep surgical site infections, as well as wound dehiscence, there was no significant differences between the two approaches. However, there was an increased risk of organ space infections in the synchronous approach, as well as any infection when all of them were combined into a single outcome. We then subsequently broke it down based on the type of hepatic resection, specifically, or repeating the analysis based on the hepatectomy. And we found that a total right hepatectomy carried the heaviest risk of organ space infections with 2.3 times the odds of risk infection in the synchronous approach. So in this study, we explored the differences in immediate perioperative outcomes, limited to 30 days after surgery between the two approaches. There was no significant differences in superficial and deep surgical site infections. However, synchronous resection does carry a higher risk of organ space infections, especially in patients undergoing a total right hepatectomy. Some of the limitations of our study, this was a retrospective review. Both of the study groups came from the hepatectomy database, so that obviously limits it. And there was no way to distinguishing where the surgical site infection occurred, whether it was due to the liver or colon resection. So to conclude, synchronous resections with a right hepatectomy increases the risk of organ space infections, and surgeons should be aware of this risk, discuss this with their patients preoperatively. Thank you.